This is Dr. Paul Goodman, a practice owner of 15 years, a dentist of 18 years, and someone that strives each day to be more successful, less stressed, and reduce the number of times I feel like crying inside a day as a dentist and human. Here are a few of my 5-minute systems that may help you streamline patient communication, help with your systems. One is our orange form. That is our new patient and emergency form. When someone calls up, we fill out this orange form first, and it's reviewed with one of the dentists so we can pick the best time for them to come in for an emergency. Because patients are people, dentists are people, and teams are people. And sometimes we misschedule a patient into a spot for an emergency that needs more time, or sometimes you just don't have the emotional space for that patient at 4 o'clock on a Friday, and you might find a better time to help that human being. Next form is our purple form. This is our purple implant form. It walks you through removing a tooth, preserving the bone, getting a 3D x-ray, surgical guide, implant placement, and getting a new tooth on top of it. It comes with all the codes that you can use as well. This form we find helpful for both our team and patients. Nothing happens unless people pay for things in life. Dental school does not talk much about money. They do quite a good job at charging the students for money, so maybe they should teach us about money, but they just say things like, go out there and treat people right and it'll be fine. And then you go out and you realize it wasn't fine at all, because people may want to buy into your treatment plan, but they can't move forward, great phrase from To Sell Is Human by Daniel Pink, unless they pay. So make payment options simple strategies for success. Our yellow form, this patient here, I guess I'm violating HIPAA on myself. What am I getting done? Doesn't matter. Costs $5,000. There's 3 ways to pay for it. You can pay in full and save 5%. You can stretch it out over the course of treatment, or you can use outside financing. This helps manage patients' expectations from a financial angle. And then I always like to give a list of treatment. Just want to make a disclaimer, these aren't our exact fees. This is the exact person, Dr. Paul Goodman. I have made up this treatment plan. Maybe one day I will fracture a tooth. I use the talking tip. A fractured tooth is like stepping on a piece of ice. Great one to use. You can always crack it more. You can't uncrack it. So maybe because I will be so stressed for a variety of reasons, I will fracture a tooth and need this done. And I would be talking to myself. But this treatment plan just shows a list of what's done. So we BTL all this, bring this all to life. And bonus form, if you've hung around this far, is we do full arch implant cases. And sometimes after people have the teeth removed, the bone preserved, and the short-term dentures done. Another great talking tip, dentures without implants are for smiling, not chewing. Dentures without implants, Mrs. Smith, you can use them for smiling, but they don't work well for chewing. So they'll look great if you're just, at your granddaughter's dance recital, but when you go to chew the meal afterwards, they're gonna flop around without implants. So sometimes people, and this has happened to me, I'm always looking to get better myself. I'm always looking to learn from learn from my failures. Why so dramatic, Dennis? How about just learn from times where things didn't go as well as you had hoped? Failures, so dramatic. Someone didn't understand a treatment plan and you call that a failure? Just didn't go as well as things had hoped. We have this form here for long-term cases. The enclosed treatment plan is for phase 1 treatment only. This plan is to get your oral health stabilized and free of infection. This does not include implants or long-term replacement options of teeth, because I love patients who are in their 6th, 7th, and 8th decade of life, but they've lived a lot of life, and maybe they just don't keep track of things well. I'm 43 and I don't keep track of things well, and maybe they think phase 1, when we removed the teeth, preserved the bone, and made the short-term dentures, was all they had to pay. So hopefully some of these 5-minute systems help you. If I can help you in any way, do not hesitate to reach out to me. I would be glad to share these systems with you, learn from you. Maybe you have a system for me, and we can just make this a more collaborative dental community. How about we build a community that cares about each other as dentists? One of my phrases, nobody likes the dentist, we may as well like each other. So instead of the Hunger Games mentality that dental school creates, compete, maybe we should make this post-pandemic world, are we in the post-pandemic world? I hope we are. I'm not sure if we are, but I hope we are. Maybe we should make this post-pandemic world a little more about collaboration, a little more about kindness, a little bit more about sharing and caring instead of tearing each other down. Dentistry's tried it one way for a while. The Hunger Games mentality hasn't worked out so well. Let's try the collaborative mentality moving forward. And if I can help you in any way, do not hesitate to reach out to me.